winterizing perimenopause, even if you can get away to, if you're going skiing, you're still going to be exposed to cool air and then still going to get that exposure to central heating where it's warm and then cool again. And obviously if you are skiing as well, you can get a lot of light reflection from the snow and that can worsen dry eyes. Hello and welcome to our Christmas newsletter. Hi, it's Dr. Sunny Dhesi from Vysana, and this week's newsletter, as always, includes mindfulness, menopause, and of course, medicine. So please continue watching. If you haven't already subscribed, then please do visit us at YouTube on Vysana Life and hit subscribe and hit notifications bell. We'd love you to subscribe, love you to comment. Having some great questions coming through which I'd like to share with you. Today's little tips on skincare are coming through as well, and of course I will be sharing some thoughts on medicine, especially menopause related. This, as always, is a conversation rather than a consultation. If you do require treatment, diagnosis or medical advice, then please do contact your healthcare practitioner. Obviously we are available as well for skin related conditions, treatments, diagnosis, and also for general medicine as well in primary care, as I am a GP. So please continue watching and I look forward to sharing our Christmas newsletter with you. So let's start off with mindfulness. Obviously the practice of thinking, opening, meditating and improving your mindset through either passively or actively. And passively is just letting your mind wander, let the thoughts come in, and then actively, as we've discussed, is visualizing. So one of the questions I had from the affirmations newsletter bit that we did last week was someone had come across something about gratitude, so gratitude affirmations, and then they were going through it, but they were struggling with how to put that into practice, how to implement it. They obviously, as they said it, they felt gratitude for all the things that are great in life, their family, their loved ones, their job, the house that they live in. They were working through it. But they said, well, it's all great saying it out loud, but then it kind of disappears. And I was like, there's a perfect answer to that, a gratitude journal. So for this January, what I would really recommend is sitting down, and although it's can be a little bit, some describe it as cringe, it is very, very useful. It's a gratitude journal. What you do is you write down all the months, so January 2023, February 2023, March 2023, and so on, right through to December. And under each month, what you do is you write something that you're thankful for. So, for example, January 2023, last year I had started on a health kick. I felt really good about myself. I was thankful for my health. Tick, put that down. February, I had a great half term, got a lot done for the business, but I also got to spend time with family. I was very thankful and I had gratitude for the health of my family and spending time with them. In March, we had a great time with patients, bringing in sort of a more medical approach, a holistic approach. I was very thankful for that. I wrote it down. I was very thankful for my family's health. I was thankful for us going on holiday. So these are the kind of things I like to do. So very, very, very simply, so not to waste too much time. Right, if you're watching this now, just get a piece of paper, write down the months, January 23, all the way through December 23, and it's a gratitude journal. And take a moment, move all your distractions, put all your phones down. Obviously you're watching this, you'd have to put it down eventually. But a gratitude journal is a great way of empowering yourself with positive affirmations. There was some exciting news in the medical menopause space. Obviously our focus is women's health, and we do talk about men's health as well. I, obviously being a man myself, I have a selfish interest in that, but our focus in clinic when patients are coming in, who are probably women, we focus on women's health. And one of the things, exciting developments in the menopausal medical space is a new drug. Now, as part of this newsletter, we don't really mention medications unless it's for an education purposes. I've said that at the beginning so that I can actually talk about it rather than I'm not advertising it or selling it. So the medication is called fesolintant, which is a treatment of moderate to severe vasomotor symptoms. So what does that mean? Basically hot flushes. Now at the moment, the only real medication that we have available at our disposal or medications are HRT, and in some cases what we call SSRIs or antidepressants, which have stigma attached to them. HRT is not for everyone. Obviously, if you have a history of breast cancer, then HRT is sort of contraindicated, needs specialist input, and obviously not everyone wants to go onto a SSRI or antidepressant because of the stigma associated with that type of medication. So this new medication helps with hot flushes. It has a significant impact on many women, with more than a 75% of women, this was in tests. So vasomotor symptoms can have a significant impact on many women, with more than 75% experiencing vasomotor symptoms, hot flushes, and a quarter describing their symptoms as severe. So a third of women experience long-term symptoms, which may last as much as 7 years or longer. So that's almost a decade per tap. It could start in perimenopause and continue. Obviously, it can continue after that. So having access to this medication, I'm probably mispronouncing it, so forgive me for this. So fesolintant It's a new non-hormonal treatment option which will increase the choice available to women, particularly those who can't take HRT. So the MHRA, which is our kind of medicines regulation authority, the equivalent of the FDA in America, has licensed this medication, but at the moment it's only for private use. So at the moment there's a campaign or the start of a process of getting NICE, the National Institute of Clinical Excellence, which is where a lot of guidance comes from, and then it allows prescriptions to be done in the NHS to be done. So available on probably private prescription, but not yet available in the NHS. And obviously I'm a very strong advocate that most medications or treatment options for, especially for menopause, should be in the NHS first. And obviously then if more in-depth or specialist knowledge, then obviously there's always the possibility of private, which is obviously a clinic like ours. So that was an interesting development in medication menopausal space, a new drug to help with hot flushes. Now, as always, things wouldn't be complete without talking about winter skin. I mean, the wind is howling outside today. So especially winter eyes. Now, this is a little bit of guidance or advice that I got from a good oculoplastic surgeon, Miss Murty, Rachna Murty, who are based in London. We sometimes refer to them because they are specialists in their field, especially if you're considering surgery of the upper eyelids or lower eyelids, or there's an oculoplastic cosmetic issue around the eyes. We would definitely refer to specialists as things that we just can't do in clinic. So winter eyes and perimenopause, even if you can get away to, if you're going skiing, you're still going to be exposed to cool air, and then still going to get that exposure to central heating where it's warm and then cool again. And obviously if you are skiing as well, you can get a lot of light reflection from the snow, and that can worsen dry eyes. So basically the guidance is, or the advice is, to really nourish your eyes in the chill. Hydration is key. So obviously cold air can trigger watering in an already sensitive eye. You should combat that by staying hydrated, drinking plenty of water. Not always easy, especially on the ski slopes because of the obvious, but please do. You can spritz the eyelids with water and moisturize and protect your microbiome. Things like over-the-counter eye drops like Hylo Tears or Hylo Forte can really help as well. Give yourself a bit of an antioxidant boost, and that's by incorporating the rainbow into your diet. Incorporate fruits rich in antioxidants like berries and citrus, and also supplements like omega-3. Those will help with the antioxidant element. And also have a gentle cleansing routine. Don't just slap on the soap and wash over. Make sure you take with you your cream cleanser. And that will bring me on to my next skin tip about keeping your skin hydrated. Obviously, if you are going skiing this winter, or you are going out walking, hiking, wherever, make sure, and the sun is out, make sure you do still wear SPF. Not only does it provide a barrier, but it also provides that protective layer and reduces sun damage, especially because your skin's not used to it. Sudden exposure to sun, you can induce sun damage. SPF 50 is great. Lots of good examples in clinic. If you want some advice, then obviously please do it. DM us. We have the ability to do skincare consultations virtually. I'd be happy to advise. My last little video on skincare tips, moving on from how we were talking about hydration. Obviously lots of bloopers in this video. I apologize about the whole 75% numbers can get confusing, but I hope that was okay and you watched it and you're now watching to the end, where I'm just going to share with you. This is actually our Made of More Resilience night cream or night souffle. HC complex, hemp seed oil, and also our clinically proven actives as well. So we were talking about skin hydration. So it is a night cream, but sometimes with the Rescue Balm, it is a little bit too thick. Yes, it's great to use at night time as well. But this is also a little bit of a trick I use when in this winter and cold weather, is using this cream during the dark hours, I would say, of the day. So first thing in the morning, if, for example, I was just going to go out for a walk, what I might do is actually just put a layer of this on rather than a serum like a vitamin C serum, because it's just so hydrating. So as I put this on, you can see that it takes a little bit of time to get into the skin. Fragrance free. We don't put any fragrance in our products. And one tip I would always say is we always focus on the face. We always start off by here. Alter your skin routine or your application of your skin routine a little bit. Start from the forehead, say, for example, or start from the sides and work your way in. You end up getting quite a concentrated amount of product onto here, but not around the sides. And definitely, even in the daytime, the neck. The skin is a little bit thinner. So what you really want to do is keep that hydrated. So that's my last little tip. I think we're going to take a little bit of a break from our newsletters. I think our team, our marketing team at Daniel Latto and my go-to Graham will be taking a well-deserved Christmas break, and we will be returning in the new year with more exciting newsletters, more information. Remember, it's about mindfulness. It's about menopause, it's about medicine. It's about holistic care. We are here at Vysana Live. I'm here to help, to add value. Take that value, please share it with others. Please do subscribe to Vysana Live on YouTube. Follow us, comment, ask questions, and have a brilliant Christmas. Best wishes to you and to your family for 2024, and I will see you on the other side.